Hello, everyone. I think we can go ahead and get started. I want to thank you all so much for joining us here today to talk about this really exciting new program that we recently launched at the International Society for Urban Health, the Accelerating City Equity Program, as you can see. So for the past 20 years, you all just heard a little bit of this in the welcome, but for the past 20 years, the International Society for Urban Health has been the only global non-governmental organization dedicated to advancing our mission to work across all the different disciplines and sectors to address the comprehensive urban determinants of health and health equity to attain a healthier future for all people in all communities worldwide. And at ICUH, we are strategically focused on the ways that we can now translate the vast evidence that's been gathered over the last 2 decades around the ways to build healthier, more equitable neighborhoods and cities, and to translate that into action and into impact for residents on the ground, regardless of their geography, of their background, their age, or their income. And we're just so delighted to have received support from our generous funders at the Robert Wood Johnson Society. Thank you so much to launch this vitally important work. I'm trying to go forward. So many of us are. It's an ongoing challenge. Okay, we'll see how long it takes for the next one. So evidence shows us that when we have societies with less inequity, their populations also have better health outcomes. Okay. And studies also demonstrate that countries with higher levels of income inequality tend to have worse outcomes, like lower life expectancies and higher infant mortality rates, as well as higher prevalence of mental illness and obesity. Oh, no. Okay. Sorry. Technical difficulties as usual. No. I mean, we could go without slides, but there's some pretty pictures. It's not going. Give us 1 second. Let's see if we can fix it. No. Okay. Okay, now we got it. And we know that economic inequity is continuing to grow at a very rapid clip. And shockingly, there are massive health inequities within the same city. So to illustrate the impact that our neighborhood environments can make on our health, we can look at life expectancy differences within the same city. And so in many cities around the world, the number one, the most important predictor of how long you're going to live is actually where you live. So here's an example of New York City, where it might be a little hard to see because it's small, but what you can actually see is that there are dramatic differences of up to 20 or 30 years of life based on the neighborhood. So babies that are born right down the street from one another, they might expect to live either 65 years or 95 years based on whether the places that they spend time support and promote their health or inhibit the health of the residents that are living there and make it worse than it would be if you lived down the road. So I think we also can see that the impacts of the pandemic really demonstrate a lot of those inequalities and inequities as well. So for example, lower income areas with higher rates of unaffordable and overcrowded housing conditions, they had much higher COVID case rates, and they also tended to have less public green space in their neighborhoods, for example. So why did we even start this project? As many of us have seen and experienced firsthand during the beginning of the pandemic, there's an urgent need to improve the many urban inequities that are growing bigger by the day. Yet we really couldn't find, there was a real shortage of the knowledge and tools to effectively integrate equity into sustainable development practice. So to help bridge that gap, the Accelerating City Equity Project seeks to strengthen equitable development capacity and to grow a global network of practitioners and advocates and researchers to identify and assess the tools, the processes, the policies, and the factors that have led to successful, equitable, sustainable urban development outcomes. And our initiative is working together to learn with local grassroots leaders and organizations to identify the key elements of successful equity-driven urban development practice. And the idea is that we'll hopefully be equipping cities and these grassroots organizers and our partners with the necessary tools and knowledge that they need to implement their own equity-driven sustainable urban development strategies that will lead to greater impact, ultimately benefiting the residents of cities that do face systemic racism and preventable health inequities. And so to help us do this, we set up 6 regional hubs. Each regional group of equitable development leaders is working together to identify what we call bright spot examples of policies, strategies, initiatives, mechanisms, and tools, and or measures could be also, that we can explore more about together to gain insights from into the drivers of equity in sustainable urban development practice from across the entire world. And we've developed an approach based on the fundamental belief that we just cannot achieve truly sustainable development without paying more attention and having a greater impact on equity. It is truly a fundamental piece of achieving real sustainability that is often left out. Just to orient you a little bit to our project scope, we have 2 phases. So the first phase, which we're in now, is all about learning from all of you and studying the work that you've been doing and drawing lessons from what's been done to achieve better, more equitable outcomes. And we really need all of you to help us out and to contribute knowledge that you have and learnings from your work to help us advance equitable development around the world, or that you've done in advancing equitable development that we can learn from and actually create these tools to scale. And so as part of this work, we actually had to do something that seems really fundamental. In the beginning, we had to stop and actually ask ourselves, what do we even mean when we're talking about equity? So people talk about equity a lot, right? But what we realized that there isn't one singular definition that everybody understands the same way. So we did a really extensive literature search led by one of our wonderful colleagues, Aurelia, who's in the back with us here. And we asked this question in the literature, but also to the people that we're working with, to our partners. We asked this question: when you say equity, what are you actually talking about? What are you thinking about? And so for us in the Accelerating City Equity Program, when we say equity-driven sustainable development, what does that even mean? And when we wanted to actually stop and ask you all for a second, who here, is there anyone here that's with us today that would say that they like when we say equity, like you have an idea of what that means? Just put your hand up if you, yeah, oh good. There's a few, oh good, I'm so glad. So I don't know, Miguel, I saw your hand up. Like, can you tell us what you mean when we say like city equity? What does that mean to you? Opportunities for all. Yeah. Yep. Well, that's a great definition. Anybody else want to venture? Okay, great. Yeah. Fairness and justice. Great. Yeah. Anybody else? Uh-huh. Right, right. Yeah. So you have to meet people where they are, and some people have less from the beginning. Equal starting point. Uh-huh. Anybody else? Yeah. Olga. Yep. For sure. Well, that's excellent. I mean, everything here is obviously a really important part of city equity. And I see that there's a lot of ways, you know, that we can, there's many different ways, different avenues that we can help achieve equity. So, so I think with that, thinking about that, I want to actually invite some of our regional hub leaders to come up and talk about the work that they're doing, taking the deep dives into the regional bright spots that they've identified, and to talk a little bit about how equity is being driven in the region that they're looking at, and maybe if there's any regional trends that you're already seeing or takeaways that are emerging through the process. So we'd love to hear from you. So we have Hannah Bolitho from the Oceania region. We have Waleska Caiaffa from the Latin America region. We're going to hear from Rene Loewenson, who is looking at Africa. She's coming in from Zoom today. She is far away in the world, but we're going to have her virtually with us. And then we have Somsook Boonyabancha, who is representing Asia. So should we start with Hannah? Come on up.
No. We'll just,
So we're just going to pull up the other slides. Maybe they can do it for us. For bearing with us on our first day of hybrid tech.
this is our new world, isn't it?
Yes.
Yeah.
We better learn quickly.
That's it. Great. And okay. Just use the keyboard or the, yeah. Okay, thanks Giselle, and welcome everybody. So my name's Hannah Bolitho and I am the Oceania Regional Lead for the ACE project. No. Sorry. Which? Yeah. Okay. Great, thank you. All right, I think we're in business. So this is the Oceania region. It's Australia, New Zealand and the Pacific Islands. And about 90% of the population live in urban areas. And while you can see in the land mass of Australia is obviously very vast, actually, just as a fun fact, only 0.22% of the country's area is urban. I'm an architect and an urban designer, and I work in strategic urban policy for the City of Sydney, which is one of the largest local government areas in Australia. And I live on Wongal land and I work in Gadigal land, which is about 3/4 of the way down the map of Indigenous Australia that you can see up on the screen. I'm pretty fortunate to be able to live in the land of the oldest continuing culture in the world, which is made up of over 250 languages and about 800 dialects. But the impact of colonisation is just hugely significant in terms of the health and well-being of our First Nations people. And there's significant inequity that's resulted between the Indigenous and non-Indigenous population. So when we're talking about health equity in our region, this really has to be the starting point. And it's important for me to acknowledge the traditional custodians of the land where I live and work, and recognise their continuing connection to land, which is never ceded, and pay respects to elders past, present and emerging, and extend that respect to all First Nations people here today. Our regional hub is made up of a very diverse group of people. We've got policymakers, public health specialists, academics and urban practitioners, with all the combined expertise that you can see on this slide. And over the last few months, our group's been starting to look at bright spots in the region that generally address one or more of these key issues. The first being the inequity between Indigenous and non-Indigenous people. The second being the lack of access to decision-making and self-determination by our underserved generally, and more specifically, our underserved First Nations people. Climate change. Now, this is affecting different areas in the region very differently. Sea level is particularly impacting the Pacific, but we also have bushfires, flooding and urban heat. And what's common to the whole region is that climate change is really having a very disproportionate impact on the health and well-being of our vulnerable communities. Our region's also looking at unhealthy housing, and overriding almost all of it are short-term politics that continue to prioritise profit over equity. And we see this in the way in our built form outcomes in our cities, and we also still see it, unfortunately, even in the policies. So now I'm going to go through 3 sample bright spots. Eek. Oh my goodness. Okay. The first is the Healthy Housing Project that's being run out of the George Institute for Global Health in Sydney. And this project is being run by Kezia Bennett-Brooke, who's a member of our regional hub, and she's also here at the conference today. This project is about investigating Aboriginal housing as one component of an Indigenous concept of health that's much more holistic than purely looking at just the health and physical health and disease side of things. Sorry. Okay. 78% of Aboriginal and Torres Strait Islanders in New South Wales live in urban areas, and 29% of this number live in social housing, and 25% have reported major issues with the housing. So that's structural issues, mould, damp, overcrowding, and all of this is contributing to systematic poor health and wellbeing outcomes. But in our state, in New South Wales, where we live, there's a real disconnect between the social services that are addressing the health and wellbeing side of things and the housing providers that are addressing the housing stock and the infrastructure component. And over the top of that is a lack of access to any kind of decision making in all of the, in any of it. So this project is really interesting because it's bringing together both of these traditional silos and developing an assessment tool that will look at physical health and disease in concert with the physical infrastructure of housing and led by an Indigenous team. So when we're looking at the trends and takeaways for this project, all of the drivers of equity are informing each other, but really without the participatory equity component with Aboriginal-led governance structures and self-sustaining processes, the project would fail. And I think that's probably the most transferable lesson for us to take with us on this ACE project. The second bright spot I want to talk about is a series of initiatives that all address urban heat. Urban heat is a major problem in our region. It is killing people directly through overheating and indirectly as a result of power plant failure and everyone turning on the air conditioning at the same time and then the power plant going down. There are significant health and wellbeing impacts of urban health. And in Australia, heat waves are in fact killing more people than any other natural disaster. In 2020, a suburb in Sydney's western suburbs was declared as the hottest place on Earth, with temperatures of 48.9 degrees Celsius. Penrith regularly has temperatures over 35 degrees, and it's an area with really large areas of expansive asphalt and concrete and a real lack of shade. The western suburbs of New South Wales is also the area with the largest disadvantage in terms of socioeconomic disadvantage, transport inaccessibility, cultural, climate, and environmental disparities. So to respond to this, a group came together called the Western Sydney Region of Local Councils, or WESROC for short, which is a group of 5 local government areas in Western Sydney. And they developed a whole lot of an action plan and a whole lot of cross-sector initiatives, tools, policies to address urban heat from multiple directions. And one of these directions, and really the one that's had the most political buy-in, is increasing tree canopy. So a PhD project, which was done by Dr. Libby Gallagher, a landscape architect in Sydney, used a whole lot of pilot studies to test the impact of planting trees, street trees, in 3 of these very hot areas in Western Sydney. And the research demonstrated that tree canopy is incredibly effective and efficient as a mechanism to reduce heat, and that small changes to street design and tree planting can improve environmental benefits by 7 times and reduce power bills by over $400 a year. And then backed by this research is the Greener Neighbourhoods Guide, which was developed with a team including Dr. Libby Gallagher and Dr. Michael Zanato, who's on our regional working group. This is a state government policy to deliver urban tree canopy and deep soil in areas to improve urban heat, as well as air quality and biodiversity. And the work included testing thousands and thousands of building, street and park typologies to understand the impact of mandating the planting of trees of a certain size and balancing that up against development potential. And it's led to targets that are measurable and evidence-based and can be really used when the developer interest starts to challenge. So in terms of the trends and takeaways of this bright spot, Dr. Negan Nazarian is a climate scientist. She's on our working group as well. And she really describes the strength of all of this work as the quadruple helix approach, where innovation comes together from government, industry, academia, and civil society all working together. And I think that's definitely one of the transferable lessons from this bright spot. And then the final bright spot I wanted to show was the housing and health research, which was undertaken in New Zealand at the University of Otago, led by distinguished Professor Philippa Howden-Chapman. And she and her team studied the impact of old, cold, and mouldy private rental housing on health outcomes. And this bright spot was brought to us by Dr. Marianne Tariki, who is in Professor Howden-Chapman's team and is also on our regional working group. The study found that 28,000 children and 54,000 adults were being hospitalised each year as a result of cold, uninsulated housing, and that most of the affected children come from low-income houses, with Maori and Pacifica children 3 to 4 times overrepresented. So the project included a randomised trial where 1,350 households with poor conditions were retrofitted with insulation and healthy heating, and then the health outcomes were monitored. And in the first year, the results were pretty incredible. Over 1,500 fewer hospitalisations, fewer doctor visits, fewer filled prescriptions, millions of dollars to the New Zealand's health system, and reduced school absences. And in terms of nationwide impact, it's estimated that this policy will avert an estimated New Zealand $30 million in healthcare costs over 3 years, with hugely significant long-term benefits to all household members and significant indirect benefits such as reduced parental stress from children missing school. So I think this is another really excellent bright spot, which addresses all the dimensions of equity. And in terms of what we can learn from how progress is measured, this evidence basis that was done by the university has made its way into legislative policy. So now all rental properties in New Zealand must meet these new standards. Thank you.
Thank you, Hannah. I'm going to invite Waleska up to talk about the Latin America Regional Hub.
Thank you, Giselle. Thank you, the International Society of Urban Health. Thank you for today's project. It's an honor to be here and to be representing my colleagues from their hub that I'm supposed to lead, but I want us to say that it's a very sharing knowledge process that we've learned, and we've been through the process and learning a lot about that. So thank you very much for this opportunity. I think it's passing here, right? Oops, yeah. Okay, so I'm going to this in a little bit different way from my colleague, and I just want to introduce you the region, setting the scenario of Latin America and the Caribbean, and doing a brief introduction and highlights our at least 11 out of almost 30 enlisted bright spots, or supposed to be bright spots, that we decided to, we dig during this process. And I think it was very interesting, because we thought that we wouldn't find a lot, but indeed we do have several. So I guess that this project has to be version 1, 2, 3, whatever. And I'm gonna do a little bit of the rationale for select the bright spots, how we're gonna present here, and the distilling trends and takeaways. Well, Latin American Caribbean houses about 700 million people in 33 countries. About 8% of the population lives in the city, and Latin American Caribbean are the world's most unequal region, with the enormous social disparity and a large population living in formal settlements. 8 of the 20 countries worldwide have the highest level of inequality. And for that, we thought that, well, this sometimes works, this does not. Okay, so let me introduce you my colleagues from our regional hub. They are, let's start from, let me get this from out. Okay, let's get this here. I have a Zoom thing here, okay. So we have Guillermo Bernal. Is Guillermo here? Oh, Guillermo is there, yeah. Okay, so you have Guillermo Bernal from Mexico, and Guillermo works in a placemake bright spot, which is very interesting. After this presentation, if you want to reach Guillermo and talk to him, I think he's right there available. We have Paula Guevara. Paula is from Bogota, and Paula is going to work with us on the district system of care, and I'll be presenting her bright spot, and I will explain why. Juan David, please, Juan David. Juan David is there. Juan David is from Bogota, and his bright spot is Urban 950 and the growth with my neighborhood. It's a very interesting and child-directed urban spot. Carlos Javier, is Carlos here? No. Carlos is from Lima, and his Bright Sport, he leads the Bright Sport named Community Recovered of Public Space, also belongs to the Urban 9050. Diana Ross is from Buenos Aires. She's the Intercâmbio Civil Association, and she's not here, and she's gonna speak to her in terms of our evolution on probably some system care as well. Eber Pires from Porto Alegre is the lead of the Univens cooperative, and Eber has a very comprehensive Bright Spot with several unequal situations in the city. Otávio Barros. Otávio is here. Yeah, well, he's coming. He's arriving. Otávio is from Rio de Janeiro. His Bright Spot is called Vila Encantada. And he's gonna be here, and tomorrow he's gonna present, he's gonna be in one of the AC space, and he'll be able to share with you the very interesting experience on Vila Encantada. Elis Bord is associate professor at the Federal University of Minas Gerais in Belo Horizonte, but she presented the Bright Spot named De Olhos na Maré, which is a very interesting as well in terms of the violence, and a very interesting application for report violence in the neighborhood. Solimar Rocha is from Belo Horizonte Observatory for Urban Health. She's represented me as a Bright Spot, and she's here as well. Where is Solimar? Yes, there. Barbara Garcia is also from Belo Horizonte, and she represents the CUFA. CUFA means the Central Única de Favelas. And that Bright Spot, I'm going to have the honor to present as well. And Luiz Saboia from Fortaleza, his Bright Spot is named Innovation Office. So as you can see, we tried, over those 33 countries in Latin America, we tried to select. It was very hard. It has been very hard to select a Bright Spot to bring here. But again, from the ACE project team, we've learned that everything will be available at a certain point. And I myself, that's the actual leader of this Bright Spot. Okay, so now I'm gonna show you the Bright Spot we select very briefly, 10 minutes. And for that, we struggled a lot. So we use this conceptual framework of institutions for health equity that is published in Journal of Urban Health. And based on that, on what we've learned in this process of writing this paper, we decided to select one from the government side, another one from the non-government side, and the third one from the academic side. So that's how we decided to select to do this very hard job. So the first one is the district system of care, as I told you. Paula is the lead. And the main important focus of this Bright Spot is on gender equity and access to income. It's a government, essentially, Bright Spot, but has a very multi-sectorial approach. So this is where this is in Colombia, Bogotá. And the population are the caregivers, especially women, but also men. And they are on the field since 2020. And why this Bright Spot is being there? Because there is a lot of recognition, distribution, and reduction of unpaid care work. And this is based on the 5th Sustainable Development Goal. How they do that? Well, they provide service for caregivers, also called manzanas de cuidado or care blocks. mobile units, and also masculinity workshop, among several other tasks. They use the strategy of our voice citizen science method for analysis and cultural transformation analysis. They are financed from the Bloomberg Philanthropic Prize. And if you have anything more that to questions and answer, I will pass that late for Paula. The second one is the non-government multitask bright spot that's called CUF, as I showed you. It's the translation, it's a single center of favelas, or Central Única de Favelas. Barbara is the leader of representing this bright spot, and the focus of that is on gender and racial equity, community engagement, violence prevention, economic development, and access to income and governance. This is taking place, well, CUFA, let me explain briefly. CUFA, it's in several cities in Brazil and also in other countries. But that experience that we are, focusing more, it's in Brazil, Belo Horizonte, but most, of those approaches and procedures are very similar to other cities in Brazil. The population, the target population is the formal settlement population, especially for those in slums and favelas. CUFA has a longer history, so it was founded in 1998. And why they do that? Because they want to represent and create awareness about the needs of favela community residents as a bottom-up movement for public policies change. So it's a very grassroots bright spot. And how they do that? Again, they are, as we denominate as a multitask, because they do a lot of different things. But, thinking just trying to bring you some information, we decide to, focus on the development and empowerment of women. Those women, they are supposed to support the development, or like a multiplicative person to support the development of the other women in the favelas in several fields: sports, art, culture, capacity building, income generation, entrepreneurs, training, all the things that also they could get some economic autonomy. And the idea is to get resources to implement new projects in their community. That's a very interesting thing, that CUFA has 3 representatives in the United Nations, and it's financed for several sources. I think Marianne is telling me that is the time? Okay. So the last one is the academy, from the academy, and it's the Observatory for Urban Health. It's a multi-method and transsectoral bright spot. And the main focus is to look at intra-urban health indicators for health equity and urban policies and capacity building. We are in Belo Horizonte, a citywide population, but mainly looking at vulnerable areas. Also, our population is policymakers, urban health trainees, and we are in the field since 2002, so we're complete 20 years now. And the idea is to co-identify indicators citywide for co-creation and co-oriented urban transformation policies from the health and non-health sectors. Health and non-health sectors, sorry, there is an error here. We assemble the data using update tools and metrics from several sources for evaluate urban intervention based on participatory approaches and co-capacity strengthening and co-decision for health, equity, and with multi-sector. We are a legitimate space, generate systemized information, and using conceptual model for translation and transferability of knowledge. Well, there is a lot of things that we can think about trends and takeaways, but there is a need for this is from the group, the several workshops that we have done with the group. So there is a need for collecting concrete data before and after the case implementation to better understand the impact of the community. We have to think more broadly about the impacts beyond the number. And partnership with the local government and academia may help on data collection for measuring impacts. This is not helping, Mariana. So the takeaways is sustainability can be achieved through the institutionalization of projects and initiatives so that they survive through different government administration. This is a very important thought that we have in terms of sustainability. Intersectorial work is essential, include academia, governments, grassroots organizations, NGOs. Participation and engagement of the world community must happen during all the steps of the projects and initiatives. In storytelling and media helps disseminate and inspire other communities and groups. Our final message is that we don't want to look at this. We want to see the effect. I think you've, oops. This. We have to think about the inequality in the city. Thank you very much indeed.
Thank you so much, Waleska. It's fascinating. And there's so many great examples. So thank you for highlighting a few of them. I think that now what we're going to try to do is go to Rene Loewenson, who's joining us from Zoom. And she leads the Equinet network in Africa, that it's our partners for the Africa Regional Hub. So I'm just going to look for the thumbs up from the tech team to see if we can pull it up and have her join us from Zoom. Let's see. I'll give it a second here.
Hi, can you hear me? Hi there, can you hear me?
We can hear you, but can we get our picture up?
So you have to enable my video because I'm screen sharing.
Oh, okay.
And I think you haven't enabled my video for me to for you to see what's on my screen.
Okay, we're working on it. Just give us 1 second. Amazing,
Okay,
amazing that we can hear you though. So it's kind of fascinating. Where are you now, Rene?
I'm in Harare.
Okay.
Hot Harare, sort of 28 degrees, 29 degrees, but happy to be here.
Oh, good. We're very happy to have you.
And I think you're together there with Danny Goto from Uganda from our team, and with Fasan Gomo from Zambia from our team. But I understand that Gibson Mhlanga, who's the consultant who worked with me on the project, and Sam Chaikosa from Harare have had visa issues and are still on the way.
On the way, yes. Gibson, I know, is joining us. So yes, yeah. We have a good contingency.
And Connie Walyaro is also had visa problems from Kenya and is not able to attend. So I'm just waiting. You should be able to see my screen because I can see it.
We can see it, Rene. Please go ahead.
You can see it. Oh, okay, fine. Sorry, then I've kind of gone a bit ahead. Okay, so.
Sorry, Rene, just before you get started, is it possible, we think that we've enabled your video, is it possible to turn your camera on? If not, it's okay, we'll give a try.
I don't seem to be able to.
Okay, so that's okay. Please continue. Sorry. We can see your screens. No problem.
Okay, I'm not that attractive to look at, so you know, my slides are much more attractive than me. Okay, so I'm going to start, and just to introduce. I think we managed to skip the first slide, but this hub work comes from the Eastern Southern Africa region. the 16 countries that are within East and Southern Africa is what we covered. We did it under the umbrella of Equinet, which is a network that has been working on catalyzing equity and health across different dimensions since 1998 in those 16 countries. And in fact, Equinet has been working on equity in urban health and well-being. So we were really excited to be working with the International Society for Urban Health. And the work we're talking about here is the work we did between May and September this year that we implemented to try and within the framework of the ACE project. So the way we approached it was we did searches and review of online materials from our region on what was written about urban health equity and urban health initiatives that were promoting health and well-being. And we came up with a number of reports. We used those reports to both extract good ideas that were coming through or experiences that were coming through, but we also used them to identify 4 cities for our case studies. That's Harare, Kampala, Lusaka, and Nairobi. Harare, Zimbabwe, Kampala, Uganda, Lusaka, Zambia, Nairobi, and Kenya. And within those 4 cities, we had focal persons, 2 of whom are with you, 2 of whom are either on the way or not coming, unfortunately, but who implemented 10 case studies. They're from those cities, they know those cities, and they used both document review, but they also interviewed key informants for each of the case study work. We also have other case studies that came from the document reviews that we did. So we, by about July, when the ACE framework on equity was ready and drafted, we then applied that to the synthesis, a kind of cross-cutting thematic analysis of all of this evidence to see what we were learning. And we held a regional review meeting with the really involved actors from those example areas, as well as people from regional level to discuss and validate the findings. So we have written up the case reports, they're online. And we've also written a synthesis report with the kind of learning that we have pulled from it, and that's also available online. So just to introduce to you the 10 bright spot case studies that came from with the focal person work, and you'll hear more about them, I think, in the course of the discussions. There were 3 from Harare, that were focused on water and sanitation, and 2 that were largely around urban agriculture and food security. In Uganda, there were 3 quite different ones. One was on waste management around flooding, one was on micro gardens on food insecurity, and one on water and sanitation. In Lusaka, Zambia, the case study was on a participatory dialogue to bring communities into planning and budgeting in frontline care services and have more agency around what was happening in their services. And in Nairobi, Kenya, there were 3 also interesting examples. One working with using the unused public spaces in the slum areas for multiple services and as an area-based approach. And then 2 that were also largely around working with informal food vendors and urban agriculture. So I will give you a little bit of a touch on some of these. So Mariana asked us to put a slide at the beginning on what were our takeaways from the work, and so I put that, but I'll have to return back to it because otherwise it may not make sense. But just to say that our region is one which has long-standing inequalities and deprivation. I think the slide that Hannah showed about colonialism is very much pertinent to our region as well. But we also have these new issues of new climate and emergency, pandemic and economic challenges for our region. And it's a region which has a lot of global influence in terms of what's happening. Neoliberal globalization has had quite an impact in our region. So when we looked at across our different case studies, and I think this has come through from others as well, we really found that the gains were largely made around these participatory dimensions of equity, the voice and agency dimensions, and the recognitional dimensions, the understanding of what was going on, of gathering of the evidence of visibility of what was going on. And that this was happening even though the contexts were particularly harsh. They were often in very marginalized communities, and that these were very important dimensions of equity to lever other equity outcomes. What we found in terms of both distributional equity and intergenerational equity was that these were often less well measured or less well articulated in these cases, were often not even explicitly a goal, but because these experiences were usually happening in marginalized communities and producing well-being gains, there was, you could say, distributional equity was taking place. And also because a number of the case studies were implicitly looking at intergenerational equity because they were focusing on young people. We have a very high youth population in the region. So there was an involvement of young people, and they were also focusing on urban biodiversity and urban environments, which is a critical dimension of our futures. But across them, we really saw much more limited gains in the structural equity issues, the laws, the policies, and the sort of underlying conditions that determine these conditions that we were finding in these areas. And this is often because these things happen at national and global level in our countries. And so while initiatives at local level might make sort of local changes, they're often not able to tackle some of these higher level order issues. So to sort of reverse back a little bit and go into our region, yes, it's a region of rising urbanization with a lot of people now living in slums and unplanned urban areas. We have very poorly measured within area socioeconomic inequalities, and so deprivation is often hidden in terms of formal systems. And most people are struggling, in a large proportion of the urban populations are struggling with what we could call the social determinants of health: housing, water, sanitation, management, food, energy. And by the way, this is not only lower income groups. I mean, in my home, I have, electricity goes many hours a day. I don't have water, etc. So, we have a real kind of problem with urban infrastructures, and we have these new issues. And so not surprisingly, most of the initiatives we had really were focusing on these social determinants, and particularly for resolving some of these problems. But we also had some that were focusing on social groups like slum dwellers and urban farmers or vendors, some that were more systems focused, so beyond a particular focus, but looking at water, sanitation, and hygiene systems, or primary healthcare systems. And then we had some really interesting ones that were really area-wide spatial focus. So I'm going to give you a very quick tour, like the others have done, of only one example from each of our cities. The first one, and we have many more. So the first one was from Nairobi, and this was an area-based spatial initiative where a group called Konkui Design Initiative. And I need to say most of these things were being catalyzed by local organizations, with sometimes global partnerships, but mostly local, including the technology innovations. So the Konkui Design Initiatives were, in this example, was working with communities in Kibera slum area of Nairobi to try and look at the unused slum areas to create public spaces within which, working with the communities, they could look at the kind of services, the business spaces, the recreational spaces that the communities would want. And you can see a before and after photograph of improving the infrastructure, in this case, a bridge, the before and after, but then leading into the way that clustered around making available services for childcare, for businesses, etc., and flood protection. And within that, women and young people were the biggest beneficiaries as a result of the kind of activities that they were supporting. So that initiative is available in the synthesis report and in the case study report. The second one is a bright spot example from Kampala in Uganda, Bways, and I know you have Danny with you, so you will be able to hear a lot more about that one from the person who collected all the evidence and put it together. But this was really catalyzed by an organization called Tree Adoption Uganda, TAO, a local organization, non-state, and working in slum communities in Uganda that were heavily affected by flooding, and in part identified. I mean, of course, these communities are often located in low-lying areas as a result of colonialism, putting poorer people, the Black populations in the poorer serviced areas of the city. But now they also identified the need for waste recycling and using recycled waste to make briquettes for household cooking. So what started off as an issue around flooding really moved into a discussion around waste recycling and energy. So it grew in terms of the issues it was addressing. And TAO designed the initiative by really listening and consulting with the local people and then bringing on board local authority, political and civil society leaders. And they introduced new technologies, local technologies to the area to convert waste into energy briquettes, and then measured the indoor air pollution to make sure this was not creating a health problem by solving a health problem. And here too, the local community and especially women were main beneficiaries. In Harare, the example there from Epworth was really interesting because it brought in a new technology for upgrading sanitation systems to have flush waterborne systems, that in an area where there was water scarcity, by using a really water efficient technology. So it improved the sanitation system, but it also took account of the kind of environmental conditions. Again, a local partner that was a kind of small domestic private operator was brought in who developed this technology, and they created confidence. The residents association created confidence amongst the wider households, because this is a very low income community, by piloting and showing how the technology works and working with them in introducing. You can see the women there are kind of helping to install the technology within their area. And then they dealt with the water issue by bringing on a much more negotiation around water in the area through local water committees, by testing water quality to bring to the local authority to improve the water system, but also getting youth pump minders trained to be able to manage the water system as a form of employment. And then the final example that I'm sharing is the one from Lusaka, where the Lusaka District Health Authority worked with communities to use a number of participatory methods to bring planning, budgeting, to bring communities into planning and budgeting for their systems, and to really work with communities to address local health problems. So they used participatory assessments to identify community priorities, to bring into health center committees that worked with the local primary care system. They worked with health literacy outreach to all the communities to make sure that representatives on the committees were linking with informed communities. And then they trained community photographers to do photo voice, to take pictures of issues that needed to be tackled by the health system. And they really pulled the health system away from simply treating and sending people back to the conditions that make them sick, and to starting to tackle some of the massive problems that were in that area, like waste and so on. And as a result, in the area where they started, they found that they were able to control cholera for the first time in years. They were able to get more uptake of key services, and the National Ministry of Health and the minister noted these improvements and has stimulated the national scale up of this program. So these things took place over many, many years. So to recap, so what did we learn from all of that? And this has come from a discussion from our regional team and from the regional meeting and so on, and from looking across the evidence. And what we saw is there's some really critical equity-oriented features of these initiatives. One, by listening and giving voice to affected communities, you have to start with that. That seemed to be fundamental. Secondly, to map and bring evidence on hidden social conditions. But even more importantly, to use participatory approaches for that kind of mapping, so that in the process of mapping, we're also strengthening the power, the capacities, and the collective organization of the affected communities to bring their issues to the fore with the authorities. And that was often stimulated by local catalysts, often non-state catalysts, but we also saw it from local authority catalysts. And as I think others have raised, it brought together very inclusive multi-actor collaborative frameworks. In our region, it was really interesting how much local technology played a role, and how much of this technology was actually developed locally, appropriate technologies that were suitable to the area, but that were also brought in together with skills and roles so that they could link the social actions to the economic benefit. And this having economic benefit then helped to sustain these initiatives, including for young people. And a number of them switched from very singular approach to more holistic area-based approaches. A thing that we saw that was really important in some, but not all the initiatives, was then monitoring and reviewing and documenting and sharing what was happening was really important to sustain and give visibility to good practice. But it isn't always happening. But what we found was that, for example, the Lusaka work was able to engage with a regional network to help them get support for some of the work that they were doing. So we do know that so much initiative is underway. We have 19 case examples in our synthesis report. But we know that when we invest in measures for participatory and recognitional equity, it's there's lots of transferable learning there, but that it's a fundamental foundation for other forms of equity. We know that we need better within area assessment for distributional equity, and more explicit urban measures for addressing intergenerational equity. But we also know that for structural equity, we have to engage beyond the local levels, both to invest in research and development innovation. The Boyce example for example, was able to tap into a domestic innovation fund for local technology. Not all countries are doing that well. To get decent investment in public infrastructure, having public services that are decently funded, and local authorities that have some capacity and funding was really critical to expand some of this initiative. And then having an engagement with the national policy level and also the regional policy level. So what are we doing next? We've had some discussion on it, and we want to engage on the practices we've already found, because we think that to sort of develop this learning, we need to talk within the cities, the 4 cities, but also at regional level on what we found, but with the councils and the other influencers to see what do they see as feasible for scaling up these practices? What do they think are the barriers for it? So we feel that rather than kind of continuously digging new examples, we need to take what we found and begin in the region. And we have a commitment from Equinet, and we hope with ICUH to work in that way from next year. So I'd like to thank you. Thanks to the project team for helping us review some of our work, for inspiring some of this work. Thanks to Equinet, the regional network, and to ICUH for financial support. Please do scan the QR code if you want to read the synthesis report. There's a lot more than I've been able to say in 10 very fast garbled minutes. And of course, talk to Danny and whoever else, Fastone and whoever else manages to arrive from our team. And thank you very, very much for the opportunity to present this really rich work that I've done, hopefully some level of justice to. Thanks, Giselle.
Thank you so much, Rene. You've given us so many exciting insights. I mean, all of our presenters so far, I've already learned so much, and I, have been aware of all the great work. So this is fantastic. And just to say, Rene mentioned it, but Danny Gatto will actually be speaking more about his project, the bright spot that he dug into, tomorrow during the ACE exhibition story talks that we're having tomorrow during lunch in the Sala de Ocio, which is actually right up above us. You can actually hear from Danny about the work that that he presented. So very excited for that. So we have one more regional hub leader that we want to hear from. So Somsook, over to you. Did you want to stay seated or did you want to come up over here? Okay, perfect. Over to you, Somsook. Thanks so much.
Thank you. Thank Giselle and the organizer to invite me here. It's my first time, but I'm really happy. And I found that the process in which we have been working in Asia very relevant. It's the same thing. Yeah. Okay. So what I will exchange with you is the process in which we have been working together in Asia under the ACHR, which is Asian Coalition for Housing Rights. We've been working for more than 30 years. Yeah. So it has developed a lot of idea how we deal with the very poor who have a problem, who have these equity problems, and how to change it in a big way, a structural change. And we are impatient not to just study and learn this, learn that, meetings and so on. No? Make clear big change, and see how what we try to develop the process. I use it.
Let's try it. I think the clicker might be working. Let's try that. Testing our patience.
Yeah. Okay. Okay. So insecure and poor housing condition. We've been working with the poor community, but in linking community into a network and with the cities and so on, you sort of moving from the poverty issue, housing issue into a structural change. Okay. If we are not working up to the level of structural change, it's become just a welfare. Yeah. So it needs scale, it needs to moving up, it needs a structural change. So I'm trying to share with you the concept and the direction, and it happened in many countries in Asia under this coalition. So the poor housing condition we have seen like this, these are equity issue you could see from the picture. The problems cause inequality, quality of life, health, and and everything you can say, yeah. So the big question is how to change with more realistic scale and speed, yeah. You've seen slum in so many countries for so many years, and you still see it. We shouldn't be patient and being, researcher and we research the change, and people are still living like that. No? So what are the concrete change that we should contribute? But indeed, all this area, this is the slide to make a relationship between poor people area and the health issue. You can see that poor people who live in this kind of informal settlements have this point of health implication. It's so serious. It's very serious. Yeah. We cannot talk about good health issue while our people are still in this kind of situation. I'm not going to read this because I have a very short time. So you just have a glance, and you can ask the printing of this later on. Okay. So our approach is that we should focus on the people and let the people be the actor. Yeah. Instead of we tell them what they should do, how they should behave, what we should deliver to them, no? Make the scale of the problems, scale of the people become scale of solution, okay? And this is very important concept, and it's possible to do. So we start by identifying all these areas, do it citywide. Identify the area, identify the group, linking people together, talk, discuss, and see what they like to do, how to move from them to the solution, yeah? So move the people in the direction in which they come together, they see the problem and they join force among themselves, between themselves and civil society and the city, yeah? So you help the city organize the people at the same time, yeah? Because the city always have lots of gaps. Asia have a lot of problems because we want to change very quickly. We want economic growth. We want city development. We urbanize very fast. So we have lots of gaps. We have the first world and the third world in our country, and within the same city. You have the first world and the third world. So lots of gaps. So how to bridge this gap, yeah, in such a way that people are the one who bridging the gap. Otherwise, the government authority will tell the people what to do and become very feudal in telling the people to follow the father. You better follow the father know best, something like that. No, we have to activate people into a proactive force to make change possible. So this is the way in which you survey the area, getting them together, doing a talk, meetings, small meeting, group meeting, issue-based meeting, big meeting, city meeting. Yeah? And in this meeting, people start open up and understand what's going on and what shall we do. So you activate the poor, the passive group, the victims of city development, of health issue, to be an active actor, little by little. Yeah. That's the point. Oh, okay. Come. So in the poor people, there are lots of problems, of course. It's an integrated problem, we can say. If we want to deal with the health issue, we cannot look at health as a technical thing. To deliver health and then they are better. No, there are causes. There are complex structure that make people the problem. So this diagram is sort of trying to make it simple that people have a lot of problems, no confidence. So we have to find a way how they get together, organize, network among themselves. If they don't have the money, start the saving, making community fund, start the finance system. Yeah. If they don't have information, okay, start the survey. Yeah. If they don't have the knowledge, okay, let's sharing, let's exchange, let them understand what are the possibilities, make an exchange visit, make a move here and there, you know, no power. They're poor because they don't have a power to negotiate. So allow them the power by get together, start organizing, talking to the government, start proposing instead of receiving. Now you're proposing, this and that. No plan, make plan. Yeah. So this is a simple way of so many different problems in the poor community, and you have to single out each of them and trying to find a way that our people start moving into the solution side. Yeah. This is very simple way to write, but of course, each of them have a set of knowledge how to work on that. Yeah. And then we need a mapping. I will talk later at the end that our bright spot cover all these areas. Some city will focus on how we do the mapping. Mapping is very important. Mapping is the way to identify where are the inequity area, who are the poor, who are the unequal group. So you got to map it, but don't do it in one area. Also, do it at citywide. Yeah, citywide. If we start working at the city scale and get the other actor to understand the structure of equity to this area. And these people in this area can also understand and speak up. Yeah. So you start moving the system and the poor people to a discussion. Yeah. And that's very, very important. Try to think about how to change the structure from the very beginning, not doing pilot project for 3 years, for 5 years, and then trying to propose. It doesn't have the weight, the strength. So we have to start the scale, start the structure, and bring everybody together from the very beginning. But let the people be the active actor to be able to talk about their issue, their problem, and what they would like to change. Yeah. Okay. So this is more or less the picture to start with the survey at the citywide scale and let the people do the survey together. So they understand the difference. Oh, why you have water, why the other don't have water, why this, why that. So it becomes a university through the survey itself. Yeah. Oh, it takes a bit of time. Okay. And from the survey, try to see how they plan it. Of course, we don't want the people to live in that slum, in the terrible situation forever. But from that, what is the land issue? Who owns the land and how, whether they stay here or they move a little bit, or what are the land options? Yeah. And once they're able to start negotiating, get some land, then how to plan it. And then from the planning, how to get the money, how to secure funding, how to make a change, and so on. So the key point is not housing solution, but how to change people, change to new conditions, change in relationship, change the system, and moving forward at scale, and link that different movement into a network, into a coalition of the small scale, a bigger scale, you know. Suddenly a new vibration would happen at the city scale. Now I talk a little bit about the concept and the movement and this relating to the blind spot, because in Asia we have been doing like that in the past 10 years and we come together believing that this is the right direction to make change. I mean, realistic change in our cities in Asia. Yeah. I hope you understand that, no? Okay. Okay, so these are some of the options. These are the picture in Thailand. I sort of being the chairperson of the committee for the slum upgrading in Thailand. We have the funding and we let the community be the active actors and through the process I mentioned before. And then they start negotiate the existing slum land, the land next to the slum, and set up a committee to negotiate. So you come into a different option. So the form is not so serious, Either it's a reblocking, either it's a reconstruction. You smash, you break all the house in the former slum. You reconstruct the whole thing. Yeah, but everybody needs to have the right. You change the form, but not the form only, but the people as well, and you make a change like that. Land sharing, reconstruction, whatever different form possible. Okay, these are like the picture of the canal project. You see on the left-hand side, the upper picture, that's the picture of the former slum like that. So in negotiating with the government, we able to secure the housing project for these people. So the people who invade the canal, obstruct the drain, move up. And the one who stay up, sort of everybody being a part of the new reconstruction program. So life change. They have funding, they have welfare program, they have everything, and have more healthy condition. So not only the physical change, you can see that when people organize, people are very considerate. They will get everybody to be a part of. In the organization, they would have the kind of the elderly people, how they would get together. You have the elderly group, you have the children group, you have the garden group, you have the women group, you have whatever you name it, because focusing by the people development, they would introduce so many different possibilities, and it become an organic development process. Which deal with health issue, deal with welfare, deal with whatever, you know. So you build many things, yeah? And you are making the active citizen at the same time. During the COVID-19, in different cities in Asia, have developed a system of community-driven COVID protection and COVID process. ICUH was able to find some support in order to let the community who usually being the victims of the COVID, because in the slum, which is not upgraded, it's a lot more problem, huh? Because it's high density, they stay together, it's unhealthy. So once community become active actor, they start making a survey, checking, and also trying to link the people with the health system. And it's a lot more effective. The key issue is that when we develop like this, I'm trying to link it into a healthy issue we are talking about. We have a positive result of the participatory citywide housing process. You have affordable housing and secure housing where people now can settle. You have the process to solve poverty and building healthy community at scale. You have the strong community which acting as a welfare unit, I mean welfare system for them. And that's the legitimacy from the informal, illegal sort of status. And they could become, with the organization, they could become active citizens. So we like to build a system where you have active citizens all over the place. So these are more or less the kind of result. And okay, and these are the scale. And on the right-hand side, we support the program like this in 215 cities in 2015, and still after that. And on the left-hand side, those are the city, more than 400 cities in Thailand. We still cannot solve all the problem in our country. Of course, we have a lot of problem, political problem, this and that, and they're producing a lot of problem all the time. You cannot keep up with them that well anyway. But among the people process, it's sort of spread out in this scale. And with this, we think it's very, very important to be the leading direction of the blind spot. Yeah, the blind spot should focus on how the people themselves will be a key actor in the process of development, in which there's so many problems at the same time, at scale, at the city scale. And housing, why housing is an important issue. how the network of the people is important, how collaboration between the people and the city to be a co-creation process among different cities are important, how the finance system, which is more friendly to the people, start from the people and link with the other finance is important, how to build a new set of professional and institution, because you have institution in our society which is so old and top down, and you know, it's the old way, bureaucratic way of doing things. It's not going to make any change. So you need new space, new possibility, new idea, new kind of institution that open up new possible opportunity for the larger group of people to work together. You need new kind of finance. You need a new professional who understand this. Once you finish university, you go to the institution. For 2 years, you become one of them. You know? So how to find a way that new professionals are possible together with the larger society, allow more room, more possibility to the people. So we have bright spot in Bangladesh, in Indonesia, in Philippines, in Nepal, in Pakistan, that would cover different aspects of citywide upgrading, a structural change at the city level, how it works out and so on. And the issue base of mapping, financing, community, and how to link with the other and so on. So this is the overall picture. So thank you very much.
Thank you so much, Somsook. Everything you say, I believe. If we shouldn't go to university, we should do something else so that we don't become one of them, then please direct me. Thank you so much. I'm always so inspired, and I'm so inspired by all of the regions that presented the work today. So if we can actually get the slides back up that I had, I wanted to go back to this, this conversation that we had before we went into these great examples around, you know, this concept of equity. And we know, of course, that sustainable development, it really just cannot be achieved without equity. And we had a slide that was looking at, for example, when we enact clean air policy, it didn't work equally well for everybody. So here we can see actually that there was clean air policy and legislation that was supposed to reduce air pollution across the US, but we see many, many years later that in fact, we still have a lot of those same disparities. So we know that equity has to be a part of the conversation, and it often still is not. Oh, okay. So through all of the research that we did, and I was talking about this concept and what do we mean by equity for the purposes of this project. So working with our regional hubs and doing this big literature review, we eventually came up with these 5 different dimensions of equity, which Hannah and some of the others started showing us a little bit of a preview of. And so just so you know, the design of how this is set up is totally still a work in progress. And we're happy to take your suggestions afterwards if you have them about how we should display the information. But just to say, you know, we're not trying to convey necessarily a process or a hierarchy as much as it's meant to show that we see equity for the purposes of our work on the Accelerating City Equity Project as needing to achieve equity within these 5 different areas. And so if we go back to, we can, maybe it's a little hard to see here, but basically the bottom one is fair systems and structures, or the structural equity element. The second one that we have here is recognition, recognitional equity, making sure that all groups are seen and valued and represented, and that the issues they face and the assets that they bring are acknowledged. So it's different actually than just participating, because it's really recognizing what they bring and how an everyday experience might be different for all groups involved. And then we do have that influence piece that so many of us have talked about. And I think we've certainly realized, even through this initial research, how important the participatory element really is. Sometimes we're finding that the process is more important, certainly as important, and sometimes even more important than the actual outcomes that we see afterwards, which I think, coming from my perspective of looking at the sustainable development outcomes that we usually have, I think that was pretty surprising, but it is so important. And then the fair share piece. So, admittedly, this is what I first thought of when I thought of equity. I thought of how are our environments actually set up to make sure that we all have equal access to the benefits that can make us healthier and have more and just have comprehensive health and equity built into our everyday lives. But it's not only about this part, although this part is also very important. And then something that we realized also through this research is that we can't forget the intergenerational piece. So I think a lot of times we see this with housing, making sure that people can actually pass on generational wealth and they don't lose the housing asset that they've created. But there's actually so many ways that we need to be thinking about the intergenerational piece and making sure that even if we achieve greater equity for us today, how do we ensure that that greater equity is passed on for the generations that come after us? So this is just showing, hopefully you can read this a little better, but this is going back to that air pollution example and how these different elements and dimensions play out in real life with one example. And so I think we're basically out of time today, but that's okay because I wanted you all to just sort of think about the work that you're doing every day and to think about these 5 dimensions. And so the exercise is, and it's okay that we don't have time to discuss it with partners today. We can maybe think about this as we go through the rest of the week. And we have a lot of different ACE activities that we hope that you can bring, the work that you're doing and your thoughts on this to the conversation. But I think it would be interesting for you all to think about the research and the projects and the policies that you're working on, and how are you doing in all of these areas? Are you achieving equity in all 5 dimensions the most that you can, or is there an area you're doing better at and maybe an area that you could do better at? Maybe everybody here is making sure that we have all the stakeholders and participants that are engaged in the process and that their voice is being heard, but are all the assets that they bring, are they being acknowledged? Are they the ones driving and leading the process? Does everybody have equal access to a park that is safe to get to? Do they have equal access to fresh and affordable foods? If they have fresh fruits and vegetables at the corner store, can you afford them? There's a lot of different ways I think that we can think about all these aspects and dimensions, but all of them, what we're finding is that all of them are really important. That's not easy, but I think for us, the first step was recognizing what is it that we're trying to achieve? And I think for us, what we're realizing is that we need to be achieving equity in all of these areas. So I think that's pretty much all the time we have together today. But if we have a few minutes, maybe we could take some questions or some comments from you all. And I want to thank all of our regional leaders for presenting the bright spots and remind everyone that we have some story talks on specific bright spots in the lunch breaks, both Tuesday and Wednesday, up in the Sala de Ocio above us, where we can actually hear from and dig into people who are involved in these projects and to help us learn better what they did right, what they maybe didn't do so right, that we can take with us moving forward. So thank you so much. And to everyone for being here. And let me see if we have a few minutes. Okay, 1 minute. Does anybody have a question or comment, or should we continue for the rest of the week, hopefully inspired a little bit by the Accelerating City Equity Project? Miguel, yay, perfect. Yes.
Yeah, the question is, when you mention involving the industry, what exactly meant to involve what was the industry? How do you run to the table? Because sometimes the industry plays a big role in creating inequities, and sometimes industry is not part of the conversations. I don't know, maybe they don't want to hear it. But anyway, can you expand on that? Thank you.
Yeah, I think that's a really good question. And I think that's one that we've been grappling with all of our multiple bright spots in our region. In terms of the urban heat and the quadruple helix approach that we were looking at. The industry, I guess, includes all of the urban practitioners and all of the very, very specific technical typology testing. So this is just for the canopy component of it, that went into proving why and how you could fit a tree of a certain size in a particular development block. So that's sort of one example, I guess, of industry. And then the other industries that are involved are all of the climate scientists. There's a lot of specific climate research that's going on that is being brought into it as well to kind of support the technical kind of side of it. So I think though we in Australia and in this bright spot, it's definitely not perfect, and the industry, like how you get the industry, all of those four players together and argue it in a way that is where the evidence is so foolproof that when the development interest comes in on top, which happens everywhere, but it definitely happens in our state, and that financial profit kind of starts to override all the rest of the decisions. The evidence has to be so strong that it counteracts that. I'm not sure if that answered. Yeah.
Thanks, Hannah. I think we might be out of time for questions right now, but I want to say that everyone who's involved in the Accelerating City Equity Program, we have these cool pins. Please talk to us. Mariana and Aurelia, who are the ACE project team, can you stand up and raise your hand there? Please come talk to us. So I should have said more clearly, but we are actually taking everything that we're learning and we're going to put it online so that everybody can access it from wherever they are in the world. And we're trying to build this, what we really believe is a new community of practice of sustainable development practitioners who are focused on equity and that have the tools and the resources to achieve greater equity. And we really need to be learning from all of you and from all of each other. So we invite you to please keep up with the project, be in touch with us. Hopefully when we get our all the work that we've amassed from the stage so far online, you all will also contribute to it, tell us what we're doing right, add new things. So you're all now part of the community. Sorry. I hope that we can count on you moving forward. And so the rest of the week, please do come talk to us, get to know us, and hopefully we'll be hearing your examples and bright spots very soon. I see that Mariana and Aurelia are reminding me, we have this really, I think it's interesting. I hope you think it's interesting too. We put together an exhibition to show some of the bright spot stories and learnings that we're getting so far. We're just in the beginning still, but we actually have a showcase of a few of those stories upstairs in the Sala de Ocio, the exhibition. It's on the entire time that we're here together. And then, as I said, during Tuesday and Wednesday lunch breaks, the people who are involved in those projects will actually be telling us the stories of those bright spots. So please check it out. And yeah, I hope you enjoy. And thank you so much for being here. And we look forward to continuing the conversation throughout the week. ACE members will meet you at the door.